Hi, everyone. I'm Greg Bakan with Fogarty Innovation, and I'd like to welcome you to our panel discussion, Weathering the Storm, the State of Innovation in a COVID World. I mean, clearly all of us working in the medical device industry, I think we're all used to dealing with changing landscapes, be it new regulations, new reimbursement challenges, or even new disruptive technologies. Actually, it's part of what makes this field such an interesting and exciting space to work in. But obviously, hey, 2020 has been a year of unprecedented levels of change. Certainly in the 30 years that I've been in the industry, I have never experienced such a complex and compounded set of economic, social, political, and even environmental changes. Central to this, obviously, has been the COVID pandemic, which sadly has claimed the lives of many vibrant people and certainly negatively impacted the health of many more than that. But the steps taken to manage this pandemic have also dramatically impacted the way we run our businesses and how we interact with our customers. So in today's panel discussion, we're going to explore these topics in more detail. We're going to take the opportunity to learn from each other by looking at how the COVID situation has impacted several companies and the steps they've taken to adapt. We'll also look ahead and consider how innovation may be shaped by this new environment. To explore these topics, we've assembled an impressive set of panelists from a range of company stages. So first of all, I'd like to introduce Leslie Trigg, CEO of Outset Medical. Outset has developed a novel all-in-one dialysis machine that can treat patients across a range of care settings, including hospitals, dialysis clinics, and even home care. The company's commercial stage and recently completed a very successful IPO. So Leslie joined Outset from Warburg Pincus, where she was an executive in residence. Prior to that, she held senior management positions at a number of medical device companies, including Lutonix, Access Closure, and Fox Hollow Technologies, all of which were very successful and acquired by large strategics. Leslie received her undergraduate degree from Northwestern University and her MBA from Haas School of Business at UC Berkeley. So Leslie, thanks so much for joining us today. Next is Dr. Harith Rajagopalan, co-founder and CEO of Fractyl Laboratories. Fractyl is developing a catheter-based intestinal resurfacing technology designed to treat metabolic diseases, including those resulting from insulin resistance, such as type 2 diabetes. Fractyl is currently conducting a pivotal study of its lead product. Prior to joining Fractyl, Harith was an academic cardiologist and physician scientist, receiving his undergraduate degree from Stanford University and his MD and PhD degrees from Johns Hopkins. Following medical school, Harith trained in internal medicine and clinical cardiology at Brigham and Women's Hospital and completed a research fellowship at the Harvard Stem Cell Institute. So Harith, welcome to you as well, and thanks for joining the panel today.
Thanks, Greg. It's a pleasure to be here.
Rounding out the panel and providing us the perspective of an earlier stage startup is Gabriel Sanchez, co-founder and CEO of Enspectra Health. Enspectra is developing a non-invasive handheld imaging unit capable of capturing cellular level tissue resolution, similar to what you would see with histology. Enspectra is actually one of the companies residing at Fogarty Innovation, and I have to say they have been a fantastic addition to the program, so we're very fortunate to have them with us. Gabriel founded Enspectra after earning his PhD and master's degrees from Stanford University and his undergraduate degree from MIT. So Gabriel, thanks again for joining us as well today.
Thanks, Greg. It's my honor to participate.
Excellent. All right, so with introductions out of the way, let's dive into our discussion. So panelists, what I'd like to do is start by asking each of you to describe the stage your company was at when the pandemic hit, the immediate impact it had, and any changes it forced in your strategy and in your focus. So Leslie, maybe we'll start with you. If I recall correctly, Outset was sort of just gearing up for commercial when this whole thing hit us. So I would love to hear how it impacted your business and how you've responded.
Sure. Well, so we really started our full commercial release in the really the first quarter of 2019. So prior to COVID, defined as Q1 of 2020, we had been on the market for about a year and growing fast. If I remember back to February, we had, certainly confidence and good line of sight visibility to making the Q1 number. And I wouldn't call it cruise control, but we were sort of sailing along with very few disruptions. I'm sure you guys do too. I remember exactly where I was the day that I realized, everything was going to change. I was in Nashville, of all places, at a Panera, bread, which is not a relevant detail, but anyway, and talking to our head of people, and I remember her telling me, we're shutting down 2 days from now, and we're all going to work from home. Like, wait, what? Like, it was not that I wasn't clued in, but I really did not believe or have any insight, as an anecdote of my marvelous predictive abilities, that this was going to be anywhere close to what it's been now, all of us mostly working from home for 6 or 7 months. So I remember that day very well. On the commercial side, it felt like, it was the ultimate roller coaster, because in the first 2 weeks of March, we just watched our pipeline that we were highly confident in and sailing along with literally start to evaporate. And in fact, when we were in Nashville, we had 3 or 4 meetings with hospital executives scheduled for that day. One of them stayed on the books. All the rest were canceled, as they were obviously had more important things to do and grappling with their own health system dynamics. And so really by mid-March, we were sort of honestly in significant worry mode. I wouldn't call it panic mode, but commercially a little bit concerned. I really credit our head of sales, Jamie Lewis. I remember her telling me, don't let any good crisis go to waste. And she much more rapidly than me, and probably within hours, had really developed an insight that and this was before there was a dialysis shortage and an acute, no pun intended, dialysis need. But even before then, really realized that the resident value proposition of Tableau had a lot of materiality in its simplicity and its detethering from infrastructure. It was something that can be moved around the hospital really quickly, and we could train people really, really rapidly and deliver dialysis anywhere that it was required. So I would say within 24 hours after that, Jamie had rolled out sort of the new commercial messaging and to our whole sales team. And then within maybe a week or two from that point forward, so end of March, we had a complete reversal because by this point, meanwhile, COVID had already started to precipitate greater organ failure, of course, kidney being among them. And so we were starting to get a lot of inbound calls. And then I'd say by the second week of April, so maybe 3 weeks in, we reached a new panic mode, which was kind of, oh shit, how are we going to make enough devices? So I will go on. I don't want to go on and on unless you want me to, but I would say wave 2 panic was, how are we going to make enough devices? Because we have 200 suppliers worldwide. Our most critical, vital supplier was located in, believe it or not, Milan, Italy, which, as you might remember, so long ago was the original epicenter. And we also, for cash management reasons, were not carrying a tremendous amount of this very expensive pump on the shelf. So we not only did not know how we were going to meet skyrocketing demand, we actually didn't know how we were even really going to be able to meet our original Q2 device forecast. And then we had about 30, as I recall, at that time, about 30 suppliers in China, in all the wrong parts of China. So our supply chain team, which is led by Kulwant, she went into overdrive, she and our supply chain team, 24/7, just trying to get us to a baseline. Can we even meet our original demand forecast? And then we started to reach up for, okay, could we figure out how to double production in April and then again in May? So I'll stop there, but I mean, Q2, the PTSD for me of Q2 was first and foremost supply chain.
Yeah. Well, what an interesting story though, right? I think that's a great example where something comes out of left field, clearly creates all sorts of logistical challenges, the manufacturing, supply chain, et cetera. But in your case, what also came with it was opportunity. What came with it was some draw, some pull, some wind in your back. Right. So an interesting tension, right? I think sometimes it's easy to say, oh, you know what's going to be hard, supply chain, we're just going to have to take the foot off the gas and manage the expectations. But, credit to you and your team that instead you leaned forward, saw the opportunity, and were able to rally the organization around fixing the supply issues and delivering products. So great story, great story.
Yeah, it was. You wouldn't want to do it twice, but it was.
Exactly.
It was a blast. It was a lot of fun.
Yeah.
But they did, and it is a credit to the team, and a lot of creative thinking. And it wasn't, when we think about supply chain, I think one thing that was, I'll say maybe one more comment. When I think about supply chain, I'm always, in the past, always thinking about components. I think what COVID really highlighted for us is full supply chain, inclusive of distribution and logistics. And so really at the end of the day, we had challenges every day, but probably the most challenging one to ultimately overcome was air freight. And because we also manufacture disposables, so that's 200 suppliers, like just on the console. We also manufacture our disposables in Southeast Asia. And so we could not get flights. We could not get any air freight capacity for our pallets. And so an ocean wasn't really going to be an option because, by the way, ports of Oakland, LA, et cetera, were locking down, and that was going to take 2 or 3 months, and we needed the disposables, not just the console. So we had a lot of tough moments just around distribution and logistics, again, from all over the world, but particularly coming in from Southeast Asia. Also, as we were competing against all the other medical device manufacturers, all of whom were also essential manufacturers, and kind of fighting for space. So that got ugly, but again, the team got through it.
Awesome. Harith, how about you? What stage were you at? How did this impact you, and how did it lead to change in strategy and implementation?
Sure. So I think COVID impacted us both from a financing standpoint, a clinical regulatory execution perspective, and commercially. So we've been a clinical stage company. We just completed a large round of clinical tests in Europe, and we expanded our CE mark late last year. We had signed an agreement with a private hospital chain in the United Kingdom to offer Revita to patients in the UK on the heels of clinical trials that we had been conducting there for several years. And we're going to launch that effort in March, having signed contracts and built a team to be able to deliver, and had begun a marketing campaign. I think I remember the date of March 12th as being the date that was the last day that we stepped in the office for a while, and the date that we realized that we were not going to be able to do anything per plan. Now, we were not relying on that revenue for our planning purposes. It was a limited launch. It was to prove the sort of the commercial proof points around our technology and its delivery. But the HCA hospital network that we were going to roll this out in called us and said that the National Health Service in the UK had co-opted all of their beds to take care of non-COVID patients because all of the main NHS hospitals were going to turn into exclusively COVID hospitals. We had to make a decision about net benefit versus net cost and risk. And we ultimately made the decision to cease plans for any commercialization and to focus on really what was core to value creation for us, which is to execute our pivotal trial. So we had to make a tough decision, but we made it quickly, and we redoubled all of our efforts and energies on ensuring that we could move ahead with our pivotal trial. We have been really lucky that we worked very collaboratively through the first half of the year with the FDA without any delays per our original schedule on getting a pivotal trial approved, which happened in May, through all of COVID. And in some sense, the ability to focus on working with the FDA to negotiate a pivotal trial that we feel proud of, and marrying that with everyone at the FDA pretty much working from home and having the dedicated time and energy to be able to do the same thing was incredibly helpful and allowed us to sort of go through the regulatory pieces of it. But it also forced us to totally change our model for how we were going to train centers and physicians and how we were going to support cases through the clinical trial. Our plan had been to use a lot of the people within Fractyl based in Lexington, Massachusetts, and have them go and educate physicians with large animal labs, like you often do in device procedural therapies. And we had to ask ourselves, is it viable to imagine that strategy being a way to train physicians in doing this? I would echo one thing that Leslie mentioned about taking a crisis and trying to turn it into an opportunity. So we asked ourselves, what might be a more scalable, more effective, perhaps more efficient way to train doctors that sets us up for future commercialization that might ramp more easily than the plan that we had been following, which was to make sure that everyone organizes themselves around an animal laboratory. And what we did, the engineers made a heroic effort to start to develop what never really existed, which is an incredibly realistic anatomical model of the upper intestine through the small bowel that mimics a lot of the physiological forces that we have noted through the course of our clinical trials. And then we went to local doctors and then tested that bench model, showed that it actually in many ways is superior to what we had been doing with our previous training, and built a whole bunch of them, and then hired a number of people to be distributed around the US and Europe in a manner that addressed what we think to be the travel restrictions, not just in April and May, but then also what we might think travel restrictions would look like for the next 12 months, and then train them against that model. And then that's a much more scalable way of teaching doctors how to do this procedure than what we had been planning. So I feel really proud about how the team has come together in order to do that. And my third anecdote is that in the syndicate of investors that led our recent financing, one of the lead investors was an Asian fund. And I was in Asia in January and February, a trip each month. I saw firsthand, I remember the landing in Hong Kong airport in January and seeing how everyone was wearing a mask. And I immediately knew that something really serious was happening. But I remember, you may remember SARS hit in 2002, and my wife grew up in Asia, so I was sort of close to that experience, and SARS was contained in Asia. Even though I saw it in January and I saw it again in February, I did not yet convince myself that it was going to impact North America as much as it had. You know, there's a lot of discussion about the steps that the administration took to shut down air travel from China. But it was clear to me, though, once we started to see the signs sort of in February and March, that you would need something way more significant to prevent it from coming to the United States. This impacted the financing because the syndicate that we were building started to get incredibly distracted by the fact that they were all in the middle of a problem that was preventing them from going to the hospital, preventing them from having partner meetings in order to make a final decision, and then worrying a lot at the same time, not related to COVID, but about geopolitical strife between the US and China. We made a decision, and with the support of our investors, we're very fortunate to agree to just close on what commitments we had at the time. And to knowing that it would get us through some meaningful milestones. Maybe not as much as we would have planned, but enough to be able to accomplish what needed to be accomplished in order to see ourselves through. So we did that. We completed that close, and we've continued. So now we're just opening centers. We're not commercial. We put the brakes on that, and we closed our financing and are now set. Now, I guess the next set of questions we'll talk about is like, where do we go from here? But I'll stop there and say that I don't think it was as much of a pivot from one strategy to an even better strategy as Leslie might have. It was really a lot of coping with crisis in a number of different dimensions from a financing perspective, as well as clinical and commercial, and then forging a path through that to the best of our ability.
That's a great summary, boy. There's so many interesting pieces within that, right? I think the last piece about the financing is so critical, right? We've seen so many companies that were in the midst of financing when this hit. The happy stories are the ones you shared, where the investors see the value of the opportunity, they demonstrate their commitment, and they go ahead and close on what they've got available. Unfortunately, we've seen other companies where investors have actually pulled back a little bit and waited. So kudos to you and the team and your investors for getting that done. I think the other part of that story that I really enjoyed, or that resonated for me, was this the training model, right? I think there's always these histories built up on how we're going to do training. It's both a company expectation and a customer expectation. But I think one of the silver linings in these sorts of disruptive situations is it creates a forced experiment, right? We are forced to learn how to do things remotely. We're forced to think through other ways of accomplishing these goals. And so I think it's great that your team embraced that, came up with a new training model, and the customers, I think, will be more receptive to different forms of training as well, given the situation. So very exciting sequence.
If we just woke up every Monday morning and then decided to revisit all of the core assumptions around how we're going to run our business, people, it would never work, right? But then when something like COVID happens, and then you revisit your assumption about like, what is your value proposition to a hospital, or how are you going to train physicians? Like it sort of provides an opportunity to revisit long-held assumptions that may not necessarily be the right thing. And the new sort of stimulus, as terrible as it is, like that new external input forces you or provides you that opportunity to rethink those things.
Totally agree.
Yeah.
All right, Gabriel, you've had time to think about this. Tell us your story about how COVID impacted you, what stage you were at, and how you responded.
Thanks a lot. So it was interesting, and I also remember the aha moment. At first things were closing down. The kids were, on the kitchen table doing their schoolwork and everything. And I had been watching the sort of disease dynamics coming out of Europe, primarily, Spain and Italy, and looking at that and talking with the team and saying, this thing rises very rapidly, but if you look at the decay rate, it's quite long. And at that time I was like, wow, this could drag out through like June or July. And I'm thinking that was really conservative. And now we're in October, but it became clear to me that this was going to be tremendously disruptive. For a little bit of background, we're early stage company. We had a working prototype, had run a pilot study in just before closing a round in 2019, Series A round. And so we had some fresh funds, and we were working on the process of going from the prototype into a clinically deployable system to go run a pilot. And so our strategy initially was, how do we stop the bleeding operationally? This was pretty disruptive for us. We're a small team, so we don't have as many cogs in play, but each cog is doing a lot of work. And so with half a dozen people pulling multiple roles, suddenly unavailable, we were just in the home stretch of R&D where it's most efficient to really huddle around this thing and kind of bounce all the ideas off each other and tune this into kind of the final working form. And that got really disrupted. Now, when I saw the sort of the dynamics and how I thought this was going to play out, I started moving really quickly. So in the last week of March, I set up a lifeboat lab, which is basically a garage near my house. We set up home labs. So we had people literally doing work remotely in different locations, and then we would integrate all of that in our lifeboats location and give us a way to kind of keep things moving. And so that was the sort of short-term thing, was that how do we just stay operational? But then there were some interesting effects, which I think, this panel has really highlighted, which was that there was some adjustment that had to be made in terms of what I thought we were aiming towards, but also a couple opportunities. So we had just raised a substantial grant from the National Cancer Institute at the start of the year for $2 million. It's actually an 18-month timeline, but I worked with the grant agency and said, if we could really accelerate the work on this, would we be eligible to potentially extend it? And so they allowed us to really do that on a much faster time frame. And so we shifted towards some of that R&D that we could actually do in this diminished work capacity, which is a little more foundational science, but we're fortunate that our technology has enough appeal to the scientific and academic community that they're really eager to see what we can develop. So we had a couple of projects that were on the back burner and the hopper that I had really thought would be for the future, and we actually pulled those forward. And the other motivation behind that was a benefit, which is that we started to see some social shifts in the medical world towards an embrace of, telehealth and digital diagnostics, that if you had asked me a year ago, when would the culture start to accept these types of augmented diagnostic tools, I would have said it was going to take 5 years at least. And so I hadn't really thought that was something that was going to be right on our doorstep, but I realized it's right now. It's just happening right now. And there's an opportunity. There's a need for it, and there's a new appreciation and acceptance for these types of digital and augmented diagnostics. And so I realized we could take some of those R&D and features that I had been sort of thinking would be for the next generation of Enspectra and bake those in now so that we can play in this emerging digital future. And what that really came down to is boosting our data throughput to the point where we now clock our images in terms of thousands of images per hour so that we could truly train to scalable, trainable data sets in reasonable amounts of time. And the other was adding 2 other dimensions to the data so that it's a multi-dimensional image format, which actually contains much more information than traditional H&E, which should give more texture to the machine learning algorithms to jump on. And so we fast-tracked that. We basically worked on that and said that let's accelerate the timeline. We submitted the grant as extension as an opportunity to potentially extend the runway. And now we're returning back towards baking all of that into this clinical embodiment that we will take through the trial. So it's sort of a mixture of, short-term adapting to keep operational, seeing a bit of an evolution of what's on the horizon that might be advantageous, and then baking some of that in now. And so that's sort of how we've been operating.
Yeah, I think that's another great example, right, where we all have our plans. Something like this happens, you need to revisit all those plans. It sounds like in your case, it was really interesting that you could actually just resequence, right? Things that you would maybe were going to do serially, you could pull in, get done sooner. That also then opens some doors for non-dilutive funding, et cetera, which is always a good thing. So again, a great example of being able to respond on the fly to dramatic change like this. I'm going to be a little sensitive to our time here, and I'm going to jump to the next sort of thematic topic that I want to talk about. So we just talked about, all right, amazing change. How do you respond as a business? You resequence, you take the opportunity to leverage opportunities that come up for new sales opportunities. You use it to refocus time with FDA and pivotal trial design. What about the people? So tell me a little bit about how you've managed the people side of it, because obviously huge impact there. And then also, how are you managing yourself as the leader of your organization, right? In the midst of all this change, you also got to take care of yourself, and how do you manage to do that? So somebody offer up a little bit their story about how you've managed the people side and how you've also managed it personally as a leader. All right, we'll call on somebody. Harith, why don't you
in the opposite order? No.
We can do that. I can go in the opposite order. That's fair. Let me jump in. Yeah. So I'm neck deep in this. My wife and I both work from home. We have a 2nd grader and a 5th grader doing school out of their bedrooms, right? And multiple people on our team that are in a similar situation. So it's very seriously impacting and affects how people operate and how they manage. Everything is so different than it used to be. One of the main things that we did was we really rallied together, and I think that's really important. And I think it's also important to recognize that some things are still universal. So, startups have always been hard. MedTech particularly is hard. I think the pandemic just really turned the volume up and put more pressure on us. But the same fundamental tenets still hold of, leadership is just key. And I think it's still that trio of set the vision, what we're aiming for, put a roadmap down so we have a plan to get there, and then secure the resources. It's just that all of that's harder now. And an element of that is, how do you rally all the team into this and keep them all rowing in the same direction and keep everybody safe and healthy? One of the main things we did, and this is mostly self-serving, but I think this is actually beneficial for the team, is I just said, we're going to all sit down with the calendars, block out times, and we're going to have a patchwork schedule. But in those blocked out times, we are not going to interrupt each other, and you at least have the peace of mind that you shouldn't be worried that you're going to get called into a meeting or roped into something that you're splitting your attention. So we basically went through, everyone kind of had their own different model. My wife and I kind of alternate mornings where we're sort of managing the kids and what that schedule looks like, but we just blocked those times out, and we did that across the company. The positive of that is that we really don't have this torn mindset when we're in those blocks where we should be working on something else, or that we shouldn't be paying attention to our kids, for example. And I think that helps a lot. But the other side of that coin is that our days are kind of weird, right? So, they're longer, we're doing weird hours and sometimes later into the evenings and on the weekends. So it takes a lot of flexibility. And maybe that's the final element, which is just that communication is just so critical right now. And again, it was critical always, and it always has been, but it's the amplitude or the volume is turned up now. And so it's really, luckily we're a small enough team. I can still have direct one-on-ones with everybody, and we do that religiously. But it's also, the questions are a little more sort of like, how are you doing? Like how are you really doing? Not just like, how's it going? Okay, yeah, so let's work on this next thing, and trying to really understand where people are are in their mindset. We have just a standard of flexibility at the company, and also a bit of an acceptance that we can't run at the same rate that we had prior to COVID. So we're probably running at something like 75% effective rate, but with more effort. So it's one of these things where I think we've found a way to do it, but we have to be very careful and self-reflective and very carefully listening to everyone, just to make sure that the mental health and the stability is there for everybody.
Yeah, I think it's a great point, right? I mean, it is going to be less efficient now, right? So recognizing that and being able to readjust plans and expectations accordingly. And then I also love how the approach you took was, we're going to schedule it in. There's separation of family and work. Well, in this environment, it's all together. So rather than fight it, you've actually built it in as, in some ways, a line item in your Gantt chart, right? We're going to schedule time for people to do childcare and adult care or whatever else they need to do. So very creative. And again, kudos to you, Gabriel, for leading that. Again, we'll go reverse order. Harith, how about you? Talk to me about the people side and what you've done to keep yourself sane in this process.
Well, our people are everything, right? We're nothing if our people are not safe and secure and able to do their work, and then also able to manage everything else outside. And this has been such a strange period of dislocation, but it's affected each of us in different ways. Some people have had health issues within the company. Some people have had childcare issues, as Gabriel mentions, and we've seen a lot. And I think really being understanding and recognizing that everyone who's in our company, who's tends to be very mission driven, wants to do the right thing for the company and for their role in the company, and is just trying to figure out how to juggle the complexity of their life. And then on top of that, how do we as leaders keep everyone rowing in the same direction, right? Maintain that sense of interconnectivity that you get when everyone's showing up to work at the same time in the same day, and used to those habits, without totally screwing up people's lives or putting them in unsafe situations. I just think that this is another thing that we allowed ourselves to question our assumptions. Like, why are we forcing people to get in their four-wheel vehicle and then drive 30 to 60 minutes in order to show up to be next to somebody else? And maybe what we sacrifice in our ability to be together, we may gain in some other efficiencies. So we looked at our org chart, we looked at our objectives, we looked at how people are organizing their work, and we tried to do our best to reorganize the way in which we communicate with each other, so that people can have as much autonomy and individual responsibility as possible, so that small teams can have very, very good clarity on what it is that they're trying to accomplish together. And then we ensure that we just, when we get together, we're over communicating, but with the focus on people and what they're going through and what we're all trying to do together, and less about like, okay, in our weekly one-on-one, like, did you get this done? Did you get this done? Did you get this done? Like, while that is important, I think it puts a higher emphasis. This period puts a higher emphasis on choosing people and really leaning in on people who are individually motivated and individually capable, and then giving them the reins to be able to do what needs to be done, and then checking in to make sure they're doing okay and aligned with everybody else. So I find myself thinking harder about, what am I going to communicate to one of my people from a conversation I just had from another one of my people, because the likelihood that it's going to get back to them through some other organic way is way less likely. The other thing we think about is, we just hired a whole bunch of people who are a field force for our clinical trial. And so how do we imbue them with the same kind of culture and attitude and can-do spirit that the people in the company already have, which I think is innate to our culture, which we're really proud of. So what we've instituted is what we call a virtual coffee break, where our head of human resources essentially has worked to identify, create a random pairing of a small set of individuals. And from the top of the organization down to the bottom, we've all made a commitment that we're going to spend 30 minutes a week in a virtual coffee break with random other people in the organization, in order to with a mix of people who've been there for a while, people who've only been here for a short time, people who have different types of responsibilities, so that there can and the one rule is you're not supposed to talk about your work other than what you do. But it's not like, this is not another opportunity to discuss something that needs to get done. And people have responded incredibly well to this virtual coffee break. It's given them a chance to meet people and get to know people in a way that they wouldn't otherwise have done. People realize that they live 2 blocks away from each other and wouldn't have ever known that otherwise. It's crazy. And so I think that it's communication, it's devolving of responsibility, it's creating spontaneous interactions, virtual spontaneous interactions in a way that you would otherwise expect to happen in the kitchen or, in the hallway, and trying to make that happen in another way. And I don't really see us going back to a time when we're going to have everyone showing up every day, ever again. There's going to be some people who need to be there every day. There's going to be some people who need to be there from time to time. There's going to be a lot of people who we have to think about how often are we going to ask them to be coming into the office and for what purpose? Because many people have restructured their lives around this remote work. And are we going to ask them to restructure their life back around non-remote work? I feel like we needed to provide people some reassurance that we're not going to just surprise them with that. After all that's happened, we're not just going to unwind everything that we have set up, because people need the confidence and the stability to know, whatever systems they're putting in place to make their lives work, the nanny that they've hired, or the structure that the arrangement that they have with their spouse, that's probably going to need to persist for some time, and we're not going to surprise and shock people back to the old normal again.
Yeah, that's a good point. And we're going to build on that too in the last section where we talk about, all right, what's the future look like and how does innovation operate in this new environment? But that's a great point. And I love the idea that you created structured serendipity, right? One of the things we lose when we go remote is the serendipity of interaction. Well, you could just say it's gone, or to your credit, you and your team's credit, you find ways to, let's build it in structure, and you get a lot of tangential benefits from that. Leslie, tell us about how you handled it at Outset.
Well, it's where do we focus first and then where we focus now. I think for us, where we were focused first needed to be one in the field, because we did develop some virtual training programs similar to what Harith mentioned, but for us, there's no substitute there's a physicality to capital equipment. And what we found out, the virtual, yes, it got us this far, but it didn't get us all the way. So first and foremost, we really needed to get our strategy and our plans and our safety together with PPE, et cetera, for our field service engineers, and then for our clinical team that was doing all the training. I think we went through a period of about, we trained 800 nurses in 9 weeks. All across the United States. And we had sold units to the Department of Health and Human Services back in the fall, actually, for disaster recovery, hurricanes, tornadoes, et cetera, never thinking it would be a pandemic. Well, HHS called up those 50 units and we had 24 hours to get a team to New York. And we did a simultaneous deployment in 10 hospitals in a week. So it was things like that have a huge people component for us, because you can imagine the natural apprehension about being in anywhere, but particularly the Northeast and the hospitals in the Northeast at a really unknown time. So that was one huge work stream. Another was, first of all, we were homeless because we'd actually been kicked out of our office building. We were in the middle of remodeling and getting into this office, but suddenly the permits were frozen, construction crews weren't showing up. So, blessing and a curse. We didn't have anywhere to go anyway, but it was a little bit of a curse because we still do final assembly tests, all of our mechanical testing, electrical testing, and software testing on site. So then we immediately faced a problem. They're like, well, how are we going to make these devices to meet the escalating demand? We don't even have space to test them. Unfortunately, we can't really do it in a garage or in people's homes. And we need to ship out, because we ship everything outside of Outset. So there was a big people work stream to that. I won't bore you with the answer, but we made it work in a location in San Jose. And then we were still trying to transfer into this new facility in the second quarter. So that was kind of the second work stream. 3, we had decided that we were building our own facility in Mexico and taking on manufacturing ourselves. So then we had a team in Mexico that was all new and was trying to cross the border. Some of them lived in San Diego, some of them already lived in Tijuana, but we had people trans-border. And so we had a whole other work stream around, well, what are we going to do if we have a complete border shutdown? how are we going to meet these timelines for the facility construction and all of the hiring and training work to meet our forecast on getting the first units out of Tijuana. So that was a whole work stream. In addition to, we had also decided second quarter, we were setting up second source manufacturing for the disposables in Tijuana out of Southeast Asia. So that was another big, people component to this. And then last but not least, and this hasn't been brought up, and I think it deserves some attention because it was as big of a conversational, I think, watershed for us as COVID, which was the Black Lives Matter movement and the social injustice conversation, which is doesn't even do it justice. But that really hit our team hard for all the right reasons. And I found that really, really difficult. The most difficult part is Zoom, where we're trying to have, these really emotional and trying to have honest and transparent conversations about issues that really are deeply personal. And I found Zoom to be better than nothing, better than a conference call, but a very inadequate substitute to in-person. So that's probably the period of time that I really missed the in-person experience. And I would say, gosh, I hope we're all back in the building to get through moments like that together, because I think there's, in that sort of situation for our team, there was no substitute. So that, let's not forget that was in Q2, and that was kind of an emotional time for all of us. I think that's where we were. Now I think our focus is on what does the next chapter look like? And I think, to Harith's point, I think, right now we're operating in a hybrid model. We are here in our office because we still do all of our testing and we still do all of our receiving and ship out here of this facility. But I'd say we probably have on any given day 40% maybe of the employees who would normally be here in San Jose, and then the majority of our team is remote in the field anyway, and then our team in Mexico. But my crystal ball, would probably be similar to yours, Harith. I think that as long as the schools are not uniformly in and consistently in, we're obviously going to have to adapt. We have to be flexible and we have to be creative. What I've learned from this is that while yes, maybe productivity minutes have gone down, I would not say that productivity output for us at least has gone down at all. And that's been the biggest learning is, hey, we're better than this. Like, we're better than just everybody showing up in a four-wheel vehicle and sitting in a seat for 10 hours a day. So I think to be honest, we don't have the magic answer, and we're in the midst of a strategic planning process right now about with a focus on how do you protect culture, and especially, of course, with a new hiring cadence, and how do you do onboarding remotely, and but two, then how do you build on it? And what's the next kind of, what do we want this culture to look like 6 months from now, 12 months from now, assuming that we are still in a very virtual world. So I wish I had, more answers, but we're still very much in process with that planning.
Yeah, I love the point you raise about the Black Lives Matter, right? Such an important issue, such an important topic. And as you pointed out, right, I mean, it's hard to have some of the full depth of those conversations without being in person, right? I do think that there still is that law of Zoom, and whether it's that topic or also too, if you have a performance issue with an employee that you need to work through, right? That's a more challenging thing to do over Zoom than it is face-to-face. So I think we are still losing something about that human interaction that's intangible, but so important. So I think all of us are looking forward to when we are able to do more of that in a safe and a more consistent manner. So with that, in just the few minutes we have left here, maybe 5 minutes or so left, let's continue to look out on that horizon a little bit, right? So everybody pull out their crystal ball. When is it going to come back to? It's never going to come back to fully normal, partly because it's these forced experiments that we're going to embrace and make it the new normal. But how long do you think this is going to last, and what impact do you think it's going to have on MedTech innovation, and in particular med device innovation? Is it going to slow it down? Is it going to speed it up? Is it going to move different directions? What's your crystal ball? Time and impact in just a few sentences each. Start with Leslie this time.
Well, I'd say time. I hate to. I erred in the opposite direction early on. I was with like Gabriel, like, God, is it going to be through June? Do you think? Like, is it? So I probably will misprognosticate again. This is the good news. I'm probably wrong. It feels like end of 21 to me, because I just think about vaccine availability and then the distribution of vaccines, and I really hope I'm wrong, but I think again our planning cycle is around kind of culture 2021, which would be a year from now. Innovation, I actually feel vibrant and optimistic, and I listened to, and why? I just listened to Gabriel's story. Like, I would never have thought to do that. You know, daisy chaining mini R&D labs in people's homes, that's a really cool idea. And I bet you could probably take that, or others can take that 10 steps further. So so that's one, that's a great example. And two, I think adoption of innovation has accelerated massively. Again, Gabriel gave a couple of good examples of that we saw too, around telehealth, dialyzing in the home, you know, the concepts that have been floated around for years. I think people lose the why not and the hand wringing, you know, when you're in kind of battlefield mode. So both on the adoption side and then the ideation side, I really do feel more optimistic than I ever have before.
Perfect. Harith?
So timeline, I think it's, I just think about what are the steps, kind of like Leslie said, you know, what are the things that would need to happen before we return to comfort with whatever we existed before. So, you know, I'm sort of, my background is as a physician, so I sort of think about it like from a clinical care standpoint, you know. We're not even doing clinical trials yet in people under the age of 12. So the children are not going to be vaccinated for at least a year, right? Which means we're not going to be putting people in school in any normal way, at least until at earliest September 2021. Mm-hmm. Right? So there we have, and in fact, I think probably the children are not going to be vaccinated even by September of 2021, because what you would need is enough trials and enough children for all of us to feel comfortable vaccinating our children. And I just think that that's going to take time. Mm-hmm. On the flip side, I think diagnostic testing led by the device industry is going to get faster, cheaper, and more scalable. And I think that therapies are going to get approved that are really going to reduce the morbidity and mortality. So I think about like, what are the competing forces? I think vaccines are going to take way longer than we think, but diagnostics and therapies are going to be much more effective than we are currently anticipating in the balance between what the news is talking about and how we're actually going to be coping. So in the net, I'm sort of thinking summer Q3 of next year, we will be in some new version of normal where there's a lot of rapid testing. We're already seeing this when we have our field teams. I'm sure everyone is, you know, rapid testing is such a convenient way. You do have, it is a little bit of an inconvenience to deal with, but it's going to get faster and cheaper, and we'll just do it a lot. And then there are going to be therapies that I think will dramatically reduce the serious morbidity and mortality from the disease to manageable levels, coupled with the simple safety precautions that I think that in America in 2021 is more likely to adopt than it is today. Okay, so if you sort of add all of that stuff up, I think sort of the first half of 21 is going to look a lot like this, and then second half of 2021, it's going to start normalizing. With respect to innovation, I mean, I'm just continually blown away, like Leslie is, by the things that people are doing to find a path forward. You know, that spirit of innovation, the drive to do so is just incredible. And it may not look, new innovation is not going to look like old innovation, but by definition, that's innovation, right? So people are going to need to adapt and adjust. I don't think we would have ever thought that a COVID diagnostic test that could be performed cheaply and immediately would be a market opportunity. But look at the number of companies in the diagnostic space that have risen to that challenge incredibly rapidly. So I think that, I actually think that individual specific business models might be more in jeopardy than others for specific periods of time. But the opportunity to innovate and find paths forward that are going to be helpful to health of society, which I think we're all really focused on, is never going to go away.
Totally agree. Gabriel, quick closing comments. What are your thoughts?
the benefit of drawing from both of those. I agree with basically everything. I feel the same. I feel just in terms of feasibility and availability of deploying a vaccine that probably the second half of 2021 might be where we start to turn a little bit of the tide and start to see some movement. And, you know, there's a chance if things go well that 2022 is starting to look quite a bit better. I don't really see that going much faster, but in terms of the effect on MedTech, I think generally there will be a culling of the herd. It'll be a little bit of natural selection, but that'll be both good and bad. I think what survives will be stronger. I also think what survives will be tailoring to the needs of this pandemic, and needs just drive innovation. And so to close out, what I would say is when I look at the future, what the landscape looks like, I see a lot of opportunities and, you know, ideas that we've been holding for a long time. I think Leslie mentioned that they just make so much sense, but there's never been enough of a perturbation or a shock to the system to make it feasible. Now we have a chance to kind of rebuild a lot of these things, and I really think they'll stick. So my vision of that future is and particularly from an Enspectra perspective, a digitally, you know, enhanced sort of future that embraces these new approaches for telediagnostics and efficient delivery of health. And I think also a renewed interest and value in diagnostics. And for us, that's actually very beneficial. So I'm optimistic about that future. Right now, my need is just to make sure we survive in this short term so that we get to play in that emerging environment.
Super. I'll tell you what, these are such fun topics and such a great panelist. I think we could go for hours on this if they would let us, but let me wrap things up with a couple of closing comments here. So again, obviously, thanks so much to all of you for taking the times out of your busy schedules to participate in this lively and enlightening discussion. I think it's always so helpful for all of us when we can hear from others who are facing a similar challenge and learn from their experiences and how they're approaching it. I think we've certainly done that today as well. I also appreciate everybody sharing their thoughts. And honestly, I think I heard optimism, right, about the future of innovation and reminding us that, look, anytime there's a major change in an industry, yeah, it's going to create pain and major challenges. But at the same time, those changes bring about major opportunities. So you've certainly got me all excited about some of the opportunities that are going to come out of this. Not that it's going to be easy, but there's certainly some opportunity there, and innovation, I think, will continue on in its strong vein. So again, thanks everybody so much for participating.
Thanks. Thank you.
Thank you.
Thanks.